And I believe it should be a personal choice.
I find it very, very scary.
As you just heard, there's confusion and some concern among locals that I talked to today over the latest COVID vaccine guidance from the CDC. Hello, and thank you so much for joining us tonight live at 5. I'm Ivo Garcia.
And I'm Trisha Keene. COVID-19 vaccine shots have previously been recommended for everyone 6 months and older. But just last week, a CDC panel changed direction, suggesting that the decision should be left up to individuals.
Now that shift has real impact, especially for us here in our community. So I wanted to hear directly from you and get answers from a top medical expert right here in Southern Nevada. This is Diane Henry. She is a Southern Nevada resident who believes vaccines shouldn't be decided by government or policy.
It's your body, your health, and I believe it should be a personal choice.
On the other side is Julie Wignall. She says what's at stake is far too serious to leave up to individual decision making.
Oh, this is very, very concerning.
The contrasting views come as the CDC panel of vaccine advisors voted to abandon the previous recommendation for annual COVID-19 vaccine shots for anyone 6 months and older in favor of making it a personal choice. However, the panel does recommend the shot for those over 65 or with underlying medical conditions. It marks a significant shift and a break from the previous standard. With these new guidelines and with these new recommendations, as a medical professional yourself, how do you feel about this?
So I think that one thing is very clear, and that's that vaccination for COVID saves lives.
Dr. Mark Kahn is the dean of the UNLV Kerkorian School of Medicine. He tells me the panel's new guidelines didn't come with new data and that the science remains consistent.
We need to vaccinate people to keep the population healthy and to keep the population alive, and we need to prevent the resurgence or to have diseases that we haven't seen come back.
Dr. Kahn says the decision shouldn't just be about one person because viruses affect individuals differently.
If you're not vaccinated, you can transmit that disease to somebody else who may be less fortunate than you, who could get sick or even die from that infection.
For residents like Julie, she says that message hits home.
We really need to do a better job from the scientific community of sharing this information with the public in ways that they can understand so that they feel safe.
But Diane tells me it all comes back to choice.
There's too much that's unknown about the vaccines, and I am an advocate of vaccines, don't get me wrong. I think it is a personal choice, should not be mandated.
Now, Dr. Kahn also tells me the most important step is having that conversation with your healthcare provider.